Hey guys, welcome back. This is the part 2 of my topic, erectile dysfunction. In part 1, I was talking about the introduction of what erectile dysfunction means. We looked at types of erectile dysfunction. We also looked at some of the causes of erectile dysfunction, things that you could do, like talking to your partner, losing weight if you're overweight, to reduce or stop smoking, exercise, have a balanced diet, reduce stress, anxiety, and also go see your GP for any kind of medication. They sell medication over the counter now. You can access that. We also looked at emotional responses and impact that erectile dysfunction can cause to the relationship, where the man can be in denial, pass blame, be avoidant of sex altogether. And for the women, self-blame, she feels anger, she feels rejection, feeling unloved, frustrated, she feels shame, and you're going out and listening to your friends talking about how they've had a good time with their husbands, and you're there and like, my husband hasn't touched me in years, that can be frustrating. We looked at the consequences of erectile dysfunction that can cause lack of intimacy, separation, even divorce, infidelity, emotional and physical distance. We looked at other ways to explore your spouse. I believe this is very important. People just, it's not about thinking, well, you have an erectile dysfunction, then straight you just give up, no sex. You enjoy your sexless marriage. You avoid it, You don't talk to your wife about what you're feeling, and you don't ask her how she's feeling. She's also going through it, not just you. So we looked at how you can explore other ways with your spouse. You can go back to the part 1 and watch that. We talked about how you can use therapy, using cognitive behavior therapy and psychosexual therapy to help you get to where you need, to help you with your mind. It's all in the mind, And I know there are some medical problems that will cause some men not to have erection, but also you with some kind of support with physical therapy and psychological therapy, it can help. Yeah. Okay. We also looked at why there's a loss of desire, sexual desire. I mean, when you're not having sex every time with your spouse as a result of erectile dysfunction, the desire is gone. The desire to have sex, is not there, because it's either the man has lost confidence, so he starts to avoid. The woman also loses confidence and self-esteem because she feels, oh, is this my fault? Am I the one causing my husband not to, have an erection whenever he comes near me? And we looked at how you can correct loss of desire and interest in sex. Okay, so with this part 2, I'm going to talk about why is it important to use relaxation technique to reduce anxiety and negative thinking. It's always good, because we talked about anxiety performance in part 1, and one of the things that you can do to reduce that negative thinking is you can use relaxation technique, because they can offer an immediate sense of relief. Relaxation technique is about it puts your body at rest and counteracts many symptoms and of the fight-flight responses. You can also focus on the opposite symptoms. So I also list how you can use this relaxation exercises to reduce stress. So if you look inward to observe what is happening. So first of all, look inward. And I mean, I'm not saying that you should do this you know, just before you have sex, or well, you can do it just before you make up your mind to go have sex if you're feeling that you're panicky or you have anxiety about that, or you can find a quiet time to do so. Look inward to observe excuse me, what is happening in your mind. You know, what's happening in your mind. So if you think about, okay, should I try and go and have sex with my wife? Will she reject me? How will she feel? How will she talk to me? Or, you know, whatever thought comes into your mind. Look inward and observe what's happening in your mind. What fears are going through your mind? What thoughts are going into your mind? Don't just allow those thoughts to stay. Challenge those thoughts. Because guess what? If you keep being afraid of those thoughts, you will never move. You will never initiate anything. You will just sit down there and let those thoughts run round in your mind. Use breathing to keep yourself grounded in the moment. You know? So as soon as you notice that you are getting worked up, just take a deep breath. You know, take deep breaths. Practice awareness. Practicing awareness, it focuses on the external awareness. See your thoughts and acknowledge them, but let them pass. So if that fear comes or that anxiety comes, yeah, acknowledge, oh yeah, I'm afraid, or you know, I'm scared of what I'm going to do, or scared of something. Just let it pass. Let it pass. Let it pass. Start by taking your mind inward and focus on your breathing as you take a few deep breaths from the belly to fill your lungs with air. Release gently by blowing it slowly through your mouth. Start by taking your mind inwardly and focus your breathing as you take few deep breaths. And you blow it through your mouth. Yeah. Scan your body, focus on an object or item, and guide your thoughts to your breathing. There is a lot of breathing technique exercises online. You can just go there. One of the websites that I normally find a lot of resources are in is the Very Well Mind. I'm going to put the websites on this video so you can click on the website. They have good resources in terms of mental health, mental health information, psychoeducation. They have so much that you can, you know, read from there. Okay, so treatment include medical and psychological intervention. Now every man responds to medication and treatment differently. So it is advised that a combination of medical and psychological treatment be used. So for medical treatment, visit your doctor to perform a full proper diagnosis of the physical issue or the physical cause. Don't just say, oh yeah, you know, this is not working. You sit down, don't do anything. Go to your GP. Even if your GP doesn't want to do anything else, says, oh, no worry, it will pass. No, I mean, some GP, you have to strong arm them. Request for a blood test to be done. Not all doctors want to do blood tests, but tell them, listen, I need a blood test. My relationship is on the line right now. I need you to do a blood test. Request that you need a blood test to be done to rule out certain things like low testosterone levels and other hormonal issues which might cause erectile dysfunction. You see, whether you can ask your GP to prescribe any pill that needs to be taken to help blood flow into your penis. If that doesn't work, ask your doctor to refer you to a specialist so that you can see a urologist or endocrinologist. A neurologist or endocrinologist, you know, they can do the blood test that the GPs can't do, to search, you know, to look whether your glands are functioning well and all the stuff. Okay, I'm not a medical professional, so, you know, you see your GP and do your research. For psychological approach using CBT, because it's quite practical, I would say seek counseling by speaking to a psychosexual therapist or CBT specialist who understands and has worked in terms of psychosexual education. Yeah, they can help you. Reduce anxiety and negative thinking by challenging negative thoughts and beliefs. Yeah. Challenge your negative thoughts and beliefs about yourself and your relationship. Increase sexual stimulation with your partner. Don't avoid or shy away. Don't say because you have erectile dysfunction or partial dysfunction with your penis, then you will just avoid, your marriage becomes sexless. Find other ways, find other ways. Reconnect sexually with your partner. If you're in a relationship, if you're in marriage where you haven't had sex for a long time because of erectile dysfunction, you can reconnect. There was an exercise I gave my clients, and I said to them, why don't you guys play a game? Start with your clothes on. Both of you talk about, okay, what would you want me to touch you? You can start off non-sexual. Ask yourselves, okay, where would you want me to touch you? Spend 2 minutes, and then as you want, you can increase it. And then you can also do where there's another sexual game. Is called, is it mahogany? Is it monogamy? No, monogamy. It's a board game called monogamy. That is a good game, where you throw the dowel and then you guys kiss each other. You follow. It's a game for couples. That's something that you can. I'll put the name down if I can remember in the description. I'll put that in the description. Okay. Increase sexual stimulation with your partner. Don't try to avoid it or shy away, because if you shy away, nothing's gonna happen. Awareness of the sexual avoidance and encouragement to intimacy. That's something we do. Work on communication with your partner by letting each other know how you feel. That is very important. Think how you shame and avoid. How do you shame and how do you avoid? It can affect your partner. Your shaming and it can affect your spouse. Now, in conclusion, let me conclude, because I've been working all day and it's almost 10 p.m. So let me hurry up with this. In conclusion, when issues of sex when they aren't addressed, they become chronic and severe as a negative cycle, such as anxiety, frustration, embarrassment, sexual avoidance, tension, intercourse performance for fear of premature ejaculation or losing erection. It begins to dominate the relationship. You don't want that to dominate your relationship. Fear and negative motivation do not promote a healthy sex life. It doesn't. Every woman wants to feel alive in her relationship. She wants to feel like a woman. A man wants to feel like a man also. But if you are a man and you're suffering from erectile dysfunction, how can you make your wife feel like a woman? How can she make you, how can she appreciate you? And sometimes we women got to understand, when our husbands have erectile dysfunction, that, well, the man can't perform. So how else can we support the man? Now, men, if you want your wife to support you, communication. Don't say because you can't do what you need to do, you can't do the business, then you just, okay, that's it. You resign. Don't give up. If you give up, what do you want your wife to do? Well, sex then becomes a chore rather than intimacy, which involves being close, loving, warm, secure, predictable feelings and connection and being connected. Being connected. That's the aim. We want to connect each other. We want to feel each other, and when that's not there, it causes a lot of problem. So my desire and my hope for every man with erectile dysfunction is that you get to a space where you allow yourself to not shy away. And also, if you're a Christian man, you can pray. Pray to God and ask God to intervene. Ask God to intervene in your situation. Ask God for guidance on how to speak to your wife about it. If your wife is angry about it, sometimes it's okay for her to be angry. She's angry that she's losing something or she's lost something very dear in the relationship, and it's about understanding. And I want to plead with women. I know we get angry when we see that our men have lost that erectile dysfunction, have lost that erection, but we get angry. But also, let's try and understand that there's nothing, it's out of his control. There's nothing he can't do. There's nothing he can do. But if you're a man where you see that you've lost and you're not doing anything about it, then that's not good. There are some men, they know they have erectile dysfunction, and I've seen also that in the therapy room where the man says, oh, well, no, we are old, so let's leave it. Or he wouldn't help himself. You need to help yourself. And there are some men where even though they just need that Viagra to help, and sometimes the Viagra doesn't work, go to your GP to prescribe something else. There's a lot of things out there in the market. But above all, look after yourself. Yeah, look after yourself. Look after yourself physically, mentally. Look after yourself. Okay, I hope you enjoyed watching this video. This video is very personal to me, because I shared a lot of my own personal experiences, not because I want to expose myself. You come to my therapy room and you expose yourself to me. So I'm sharing this because I know it's something that clients come to me about and talk to me. So I'm hoping that my own personal experience, I'm sharing it because I'm showing that empathy, that I understand what you are going through. I'm not judging you when you come to the session and talk about, and I appreciate you so much when you come and talk about your erectile dysfunction to me in sessions, because it is very personal. It's something that I said I will release this video last year, but from 2023 I've just been holding back releasing the video right now. But if you watch the video, it's not about being judgmental, but it's been, Henzi is brave for her to be able to put this video out there, and it's to help people. I'm in a stage now in my marriage where God is healing us and getting us to a space where we want to be, where we can feel accepted, and where we can feel accepted and be able to please each other in different ways, and know that sometimes as men begin to get older, they lose their libido. We get hormonal, we get menopausal, and different things happen. So I hope this video has been a blessing to you. Okay. If you have anything to say, you can put your comments down below. Share this video with people who are going through, or who you suspect this video might be of help to. Not everybody would want to talk about their sexual life. We like to comment or watch other people's sexual life, but we don't like to talk about us. But listen, this is life. It might help somebody. Okay, so you have a very good evening, and actually good night, I will say, because it's 10 p.m. and all the best, and I hope you have a good day or good night. Thank you. Bye.